Yeah, so there's been a lot of research on nicotine, obviously, not so much looking particularly at the benefits. That's pretty scattered throughout the decades. But there is, collectively over many decades, a lot of really interesting early research showing certain benefits on mental, cognitive abilities, on mood, on particular dysfunctions, that kind of stuff. And I know we're going to talk about Dr. Newhouse's mind study later in this webinar. And thank you for having me on again, by the way, for that. Yeah, no, so what nicotine seems to do is a bunch of things. Obviously, it's a really fascinating and criminally understudied chemical compound or pharmacological, drug here that could be used in what looks like an incredible number of options for treating various mental health problems, certain cognitive problems, dysfunctions like ADHD, Parkinson's, age-related mood disorders. So it really does seem that when it comes to the benefits, and I mean, we've long known about the mental acuity that comes along with nicotine as a fairly mild stimulant, kind of like caffeine, where you're kind of wakes you up a little more, you have more focus and attention. And that's one of the reasons people in the military have very long used nicotine, unfortunately through smoking. And with studies like Dr. Newhouse's The Mind study, we're learning much more about the mood regulation aspect that nicotine provides for people. So this comes into play with, age-related mental declines and schizophrenia and ADHD, for example. And it's one of the reasons that you see, I mean, it seems to be one of the reasons that you see really high rates of smoking in these groups of people. We're talking about 60, 80% sometimes, particularly if you look at people with schizophrenia, that's about 80% of the population there is smoking, which is bad. That's not great, right? Because a lot of them are going to die from that particular habit. But it seems to be the nicotine that they're looking for as a kind of corrective mechanism for whatever dysfunction or lack of function is happening in for their particular situation in their brain. And of course, there are always risks with everything, and that includes nicotine. It is a stimulant, like caffeine, as we mentioned. But there are cardiovascular impacts, like if you exercise, if you drink coffee, if you use nicotine or any other stimulant, there's going to be some kind of cardiovascular effect. So if you happen to be a person who has a cardiovascular issue, maybe you're prone to getting tachycardia, or like fast heartbeat or something like that, that is where you would have to think very carefully and talk to your physicians or your healthcare providers or whatever, do some research, but what the risks might be for you in your particular case. And then there's also, this is something people in tobacco control talk about with whenever anybody tries to talk about the benefits of nicotine, they usually try and point to, well, it's just solving problems that nicotine caused, right? So it's just helping you get rid of the withdrawal symptoms that you are getting now because you've become dependent on nicotine. And I think that's just meant to shut down any kind of conversation on the potential benefits, pharmacological benefits of nicotine that should be studied. But if you have a mental health condition, particularly one related to mood, if you have depression or something like that, and you are using nicotine to deal with that or to help or to mitigate some of the effects of that mood disorder, and then you stop, or you have to stop, or you have to go, you choose to go off of nicotine, and then you need to be very aware that there could be, like if you're on antidepressants, you don't just stop antidepressants because it can push you in a very dangerous mental place. It could really downregulate your mood and put you at risk for suicidal thoughts, self harm, that kind of. So that's something to keep in mind if anybody believes that they're using nicotine to deal with any of these things, working with a physician about if you choose to taper down or cut off. So to work out a plan on that kind of thing. So like there's risks for everything. It seems like, we are still at the very beginning of understanding all of the different things that nicotine does in the brain and the body, but it does really seem to have profound effects on things like inflammation. All right, so that's where you'll see diseases like Crohn's disease, which is an autoimmune disease that affects the stomach, Parkinson's, Alzheimer's, Tourette's, and Behçet's disease. I don't know if anybody's ever, there's a really interesting study. Behçet's disease is, they believe it's an autoimmune disorder. It causes really painful lesions on the inside of your lips and your mouth. And they did a very, very small study, and they took some patients who had active Behçet's lesions, and they gave them transdermal nicotine, so a nicotine patch, and it resolved the lesions in I think 4 out of 5 of the patients. The other one, the other patient, it didn't work for them because they kind of refused to use the patch. And people with Behçet's do also have a higher risk of smoking, or they are more likely to smoke than the general population. So it seems like whether or not they know it, people are using nicotine as sort of a self-medication or a method of self-care. And it would be very important for them to know that it isn't smoking that is giving them that, and that there is a safer way. If they want to continue reaping whatever benefits they believe they're getting, they can get those with nicotine from a non-combustible source, whether that's a patch, gums, or e-cigarettes, or whatever.